Music and child development. In this PowerPoint, I plan to cover 4 broad themes. First, the biological timeline for hearing. Second, a phenomenon known as the Mozart effect. Thirdly, usual characteristics of children that are regularly exposed to music. And finally, some interesting studies. Before we discuss how music affects someone developmentally, we must answer the question, at what age do people start hearing? During the last 2 months of pregnancy, we know that a fetus can hear people's voices and even music. So a fetus can hear, but are they recognizing what it is they're hearing? In 1986, 2 psychologists, DeScasper and Spence, wanted to find out if a fetus that had heard Dr. Seuss's classic story, The Cat in the Hat, while still in the mother's womb, would prefer hearing the story after birth. During the last months of pregnancy, 16 mothers read The Cat in the Hat to their fetuses. Then, shortly after they were born, the mother either read The Cat in the Hat or a story with a different rhyme and pace. The infants sucked on a nipple in a different way when the mothers read the 2 stories, suggesting that the infants recognized the pattern and tone of The Cat in the Hat. This study illustrated that a fetus not only hears, but can learn while in the womb. So we know that a fetus can hear and learn, but what role does music play on a person's psychology? Let's look at the Mozart effect, which is defined as music that's used to enhance the quality of life, including health, wellness, education, creativity, and emotional expression. In 1957, Dr. Alfred Thomas began experimenting using music in children who had speech and communication disorders. He invented a device called the electronic ear that would send high-frequency messages through the right ear to the left brain for repatterning the perception of auditory stimulation. He had 200 centers open worldwide and found that Mozart's music worked the best. On to some physical characteristics. From birth to 18 months. This period coincides with Piaget's sensory motor stage. During this stage, a child builds its understanding of the world based on its senses and how it interacts with the environment. You can see this when a baby discovers a musical beat and starts playing on pots and pans. 18 months to 3 years. Children of this age fall into Erikson's autonomy versus shame and doubt stage. During this stage, children begin to develop their independence and realize they have a will of their own. Music allows a child a positive and creative outlet for their independence. 3 to 5 years. This time matches with Erikson's initiative versus guilt stage. During these years, children encounter an ever-growing social world. This is the time most children begin preschool. This is also during Piaget's pre-operational stage, in which children begin to represent the world and begin using symbolic thinking. From 5 on, industry versus inferiority. During this time, children are immersed in school life. Erikson said that children direct their attention toward mastering knowledge and intellectual skills. Studies have shown this. 2nd and 3rd grade students who are exposed to music-based lessons score a full 100% higher on fraction than those who learn in the conventional method. Identity versus identity confusion. During this time, people are trying to discover who they are. A university study found that pattern recognition and mental representation scores improved significantly for students given piano instructions over 3 years periods. They also found that self-esteem measures improved with students given piano instructions. There's been a lot of study done for the benefits of music in educational performance, but did you know that middle school band members scored significantly higher than their non-band peers on standardized tests, and that music majors are the most likely group of college grads to be admitted into medical school? There was once a study of 69 children with autism, attention deficit disorder, and epilepsy, which showed that when they were exposed to music, and in some cases for periods afterwards, their social skills and concentration improved dramatically. A related study provided that after a year of piano lessons and music therapy, the seizures of 79% of epileptic patients disappeared completely. Research shows that piano students are better equipped to comprehend mathematical and scientific concepts. A group of preschoolers received private piano keyboard lessons and singing lessons. A second group received private computer lessons. Those children who received the keyboard training performed 34% higher on the test than children who used private computer training. In conclusion, music has been proven to provide many more benefits to children and adults than simple entertainment. It has been proven to help patients recover from diseases and end surgery more quickly and with less pain. Music research is currently being undertaken to learn the effects of music on the mind and body. And still, we know that music can have a very positive effect on child development.